So our last speaker is Katie Butler, who's from the LA County Department of Health. One of the reasons that we wanted to do this panel is that because of the very uncertainty that Dr. Goldstein was talking about in terms of information available to the public, there's also that same uncertainty with respect to information available to public health officials. And yet they are the ones who are tasked with making decisions about evacuations or withdrawals from certain areas. So I wanted to have Katie come talk. She has very recent, very in-depth experience with the Aliso Canyon leak. And so she's going to talk about her experience there and the decision that the Department of Health had to make there. So welcome, Katie.
Thank you for having me speak today. Good afternoon. I'm an environmental epidemiologist, and I've been at the LA County Health Department for a couple years. I was in private consulting in my previous life as a risk assessor and practiced toxicology. And this incident that I'm going to go over, I hope that we can touch on some of the issues and items that Dr. Goldstein brought up as far as indirect public health impacts that aren't on the list of symptoms reported initially to a health department, but are things that the health department and all agencies and the operator all have to be very aware of in responding to an incident of this scale and to more minor and moderate incidents as well. So I'll start by giving a brief overview of the Aliso Canyon natural gas disaster. I'll focus on some of our primary public health activities in response to the disaster and go over things that we continue to face today and touch on some of the challenges. So on October 23rd, the largest methane leak from a natural gas storage facility was discovered by the operator, Southern California Gas Company. And the next day, October 24th, the air agencies were able to deploy into the community to get air monitoring equipment out there and measure methane, along with benzene, toluene, some of the other primary pollutants that were of concern for a leak of this scale. And 5 days after the leak was discovered is when our public health agency was notified. And in that initial week, our office immediately started receiving complaints as far as nausea, headaches, eye, nose, throat irritation were the primary symptoms that were reported. And we held a community meeting within that first week to really gauge what the community was experiencing on the ground. And at that community meeting, it was an eye-opener, I think, for every single agency on that panel. Because we heard firsthand from the noxious odor that people were experiencing and how that was really debilitating their everyday life, and how the symptoms people experienced were very wide-ranging because sensitivities differ so greatly when experiencing the sulfur odor from natural gas leak. Some people would have a minor headache, whereas some people were doubled over with nausea and coughing, severe respiratory issues, especially with pre-existing asthma and other respiratory diseases that some people may have faced previous to this incident. And within the first 2 months, there were 8 top kill attempts using primarily barite mud and calcium chloride, and none of those attempts to kill the well were successful. In fact, they created a very large crater around the wellhead, about 40 to 60 feet in dimensions, and made the wellhead very unstable. And in late November is when the bottom kill solution was began to be implemented by drilling the relief well. So all in all, the gas leak disaster lasted for 4 months, and was finally sealed on February 11th. So to illustrate the wellhead and the size of the crater that was caused by all of the well kill attempts, this was a picture released a couple days ago in the National Task Force report. And it also shows you the petroleum material, the crude oil that was emitted during the incident because of the history of this natural gas storage facility as a petroleum extraction site. Here's an illustration of the leak using infrared camera technology that's been color enhanced. And since methane is invisible to the eye, that also created significant challenges in our agency response. It required us to deploy monitors very quickly and across a very large area in order to determine the extent of the leak, which communities it was reaching, and at what concentrations. It also made it difficult for the community to realize what they were being exposed to and even communicate amongst themselves, because the geography here is so varied. It's pretty hilly, so there were communities or a block of streets that would experience a severe sulfur odor, whereas one block over they might not have experienced a sulfur odor just because of the ways that the gas pocketed in different areas of the community. The California Air Resource Board released these estimates of the methane emissions, and depending on who's calculating, there's still a little bit discrepancy here, but approximately 90,000 metric tons of methane was released from the well. And you can see that the largest amount of methane was released in the November-December period. And that was when the well kill attempts from the top were being done. And then once we moved into January and February, we saw a pretty sharp decrease in the methane emissions. So here's the list of symptoms that were very commonly reported to our office. We were able to pull the report from Alabama that had done a study on mercaptan odor, and many of these symptoms lined up with that report on what we would expect from a community that was exposed, and there's reports that they still may be exposed to tert butyl mercaptan. And tert butyl mercaptan is about 50% of the sulfur odorant mixture used at this facility. The other 50% is a compound called tetrahydrothiophene. And the toxicology data on that particular compound is more limited than the mercaptans, but we did have this community health study on the same mercaptan compound from Alabama, and our symptoms matched up. So our preliminary health assessment determined that it was the mercaptan, the sulfur odorant, that was causing the health symptoms. I want to point out, however, that vomiting and nosebleeds were not reported in the Alabama study. So those were two symptoms that did not line up with the report of mercaptan exposure in Alabama. The map of symptoms reported here shows that symptoms were pretty consistently reported up to a 5-mile radius from the source of the leak. So that's a considerable area. This is densely populated Los Angeles. And the green star on this map shows you the location of the leak. SS25 is the name of the well. And this mapping was very helpful for our agency response so that we could understand, okay, where are the majority of people experiencing health issues that they believe are, result from this leak. In the first days of the leak, the operator and the agencies, I think we're all very optimistic that it was going to be stopped within a matter of days, if not a week at most. And from our public health perspective, the symptoms people were experiencing maybe could have been tolerated for a week. And once we found out that the top well kills were not working and other solutions were being researched, we got the sense that the timeline is very uncertain. So we had to make a decision as a public health agency to take action and issue this directive for relocation. And knowing full well that there are other unintended health consequences of relocating people. There's several senior communities in this area. Of course, there's pregnant women, other people who may have chronic diseases, and relocation is very difficult. It's a very difficult solution for some people. And it takes them out of their environment, it takes them out of their social networks. Kids had to go to different schools. So imagine you have a teenager who now is at a completely different school. He doesn't have his normal social support systems and can't play the sport that he played. That's his outlet for health and well-being. So all of these unintended kind of consequences that we didn't fully realize, in the midst of everything. The agency air monitoring locations were quite extensive. There was real-time monitoring on a daily basis that people could access on a website and look at the measurements of methane and benzene in real time. So, the California Air Resource Board and South Coast Air Quality Management District, I think, did a great job communicating this information to the public in a very challenging situation. And the operator also did, Southern California Gas had about a dozen additional monitoring locations on top of these. So altogether, about 20 different monitoring locations. There was a great deal of data being generated and being communicated to the public. For the most part, methane and benzene were the primary chemicals being monitored in air. But having seen the wellhead, the picture I showed you earlier with the crude oil deposition, and then knowing that we might be dealing with a more crude oil mixture, gas oil mixture here, and knowing that the incident could last 4 to 6 months, we didn't have an end date. We had to operate under the assumption that this could be long-term exposure that we're facing and that we have to evaluate to protect people's health. So the Department of Public Health in Los Angeles, we called for more extensive testing of a longer list of chemicals in the air. This testing didn't happen as soon as we would have liked. It happened in January. So when the largest amount of methane emissions in November and December were occurring, we didn't have data on all of the other chemicals we would have liked to. But it was good that we were able to get this data in January, and it did show that there's other metals, barium, which plausibly from the drilling mud, polycyclic aromatic hydrocarbons, or what we know as the black soot material, benzene, which we knew, cyclohexane, toluene, other volatiles were along for the ride. And so we were able to look at those more closely when we had that data. And that was important for us and for the community so that we had a much better understanding of the full extent of the leak. And the benzene levels during the entire course of the leak, they really didn't exceed the highest range of what's normal for Los Angeles. So this is a less urban area. It's up in the hills, so you wouldn't expect to see benzene levels that look like the major freeway, the 405, but they still did not exceed what that highest end for Los Angeles normally is. So that was good news for us. It was good news for the community. And we tracked it very closely to make sure that on average they were not going to exceed a subchronic level of concern. So during the leak, the sulfur odorant appeared to be responsible for the majority of the symptoms, but we did still have some uncertainty about the nosebleeds and the nausea. We had some data gaps in information, so looking back, I think we've learned lessons on how we can more quickly deploy air monitors on a large scale and work together with all the agencies that need to be involved to share information more quickly. After 4 months, when the well was sealed and relocated residents began moving back home, the methane levels dropped off immediately. So we expected to see the same drop-off in symptom reporting, but that's not what happened. We received over 200 calls in that week after the leak was sealed. And that was surprising to us because we thought most of these chemicals are volatile, they're going to dissipate quickly, there's not going to be residual material in people's indoor environments. And one of the other things that we found out when people started moving back home was that there was frequent reports of oily residue. So there was at least one misting event that we know of that caused these types of oily droplets to be deposited on people's homes. And the testing showed it was consistent with heavier crude oil, long-chain hydrocarbons, and that made sense knowing the history of the reservoir itself. So if you didn't know to look for this, you might not see it because the residue in some places, as you can see from these pictures, is so small it could be mistaken for like rusty playground equipment. So that was something that we had to start looking for after people started moving back home so that we could understand the full extent of that. We had 2 significant public health response activities after people moved back home because of the continued symptom reporting. We did a health survey. We deployed 50 health workers in 3 days to do a door-to-door survey so that we could understand what is the real prevalence of the health issues being reported. And then we also did indoor air and household dust testing. Before the leak, people reported about 81% of households reported symptoms. After the leak, we saw a decrease to 63%, but that's not as large of a decrease as we expected to see. So we thought we still had an issue that it's possible people could be exposed to some residual material in their environment, and that's why we followed up with an indoor exposure evaluation. We tested for the full list of chemicals that could be associated with natural gas or crude oil in people's air and dust. And we found that there were some metals in dust, primarily barium, and a few other metals used in the drilling muds that were found at higher concentrations and more frequently in homes closer to the leak compared to our control population, which was further from the leak in an unimpacted area. And so as a result of those findings, we recommended that all of the homes be cleaned, and this mainly consisted of wet wiping, HEPA vacuuming, and also cleaning the air ducts. And we had practical recommendations for people as far as changing their air filters go, laundering their clothing, and other measures that they could take to make sure they flushed out and ventilated any kind of residual contaminants. There's still a long road to community recovery. This is about 1 year after the gas leak started. And community members still continue to report symptoms to our office, although not nearly as frequently. And now they're starting to talk about how the community has been divided because of this incident. There's a lot of stress and anxiety that's very thick within the community, uncertainty about reinjection, when Aliso Canyon will be reopened. And so going forward, it's going to be very important to continue to monitor the environment so that we can have data to show the public and other agencies what the current environmental conditions are, to continue to follow up on health, symptoms, and continue to engage the community and make sure that's a two-way conversation as reinjection moves forward. Lastly, a long-term health study is being moved forward, the scoping process between the county and the air district because of the unprecedented nature of this incident and some of the uncertainties that still exist. So thank you very much. I appreciate it.